Hey, welcome back. Today we're diving into something that affects a massive number of people, and most of them have no idea: essential hypertension. You've definitely heard the term high blood pressure, but what you might not realize is just how serious this silent killer really is. So let's get right into it. I want to start with just one number: 1 billion. Let that sink in for a second. That's how many adults worldwide are estimated to be living with hypertension. It means that statistically, in almost any room you walk into, you're with people who are dealing with this. And a lot of them, they don't even know it. And make no mistake, this is not some minor health issue. For over 3 decades, since 1990, it's been the leading cause of death and disability worldwide. That is a staggering track record. So what is this thing really? And why is it such a massive problem? Let's break it down. To really get a handle on this, we've got to start with the absolute basics. When a nurse wraps that cuff around your arm, what are they actually measuring? And what do those numbers mean? Okay, so the easiest way to think about it is like this. Picture your arteries as a garden hose. Blood pressure is simply the force of the blood pushing against the inside walls of that hose. You get 2 numbers, right? The top number, systolic, that's the peak pressure when your heart beats, like turning the tap on full blast. The bottom number, diastolic, is the pressure that's still in the hose between those heartbeats, and you need to pay attention to both. So when does that pressure become a problem? Well, the official line in the sand, according to the latest guidelines, is a systolic pressure of 130 or more, or a diastolic pressure over 80. And I really want to stress that word or. It's not and. Just one of those numbers being in the high zone is enough for a diagnosis of hypertension. All right, let's look at this chart, because this is super important. You see, normal is anything less than 120 over 80. But look at that next category, elevated. That's like the yellow warning light on your dashboard. It's not hypertension yet, but it's a major heads up. Then, once you cross that 130 systolic or 80 diastolic mark, you're officially in stage 1 hypertension, and that's when the risks really start to ramp up. Okay, so we've got the numbers, but what are they actually doing to your body? Let's talk about why this constant high pressure is so incredibly dangerous, especially when you often can't feel a single thing. And that brings us to that really ominous name you've probably heard a dozen times. Why on earth is hypertension known as the silent killer? Well, the answer is as simple as it is terrifying. It's because most people with high blood pressure feel completely fine. There are no symptoms, no red flags, no warning signs at all. You're just going about your day, feeling normal, while this immense pressure is quietly doing damage inside your body. It's often only caught by chance during a regular checkup for something else entirely. And when that silent pressure isn't controlled, the consequences can be devastating. Think of it as a constant, relentless strain on your entire plumbing system. Over years, that wear and tear can lead to a catastrophic failure. Things like a stroke, a heart attack, your kidneys shutting down, or even a ruptured aneurysm. It's a systemic, full-body problem. And if you think a small jump in those numbers doesn't matter, think again. This is where it gets really sobering. Research shows that for every 20-point increase in your systolic pressure or every 10-point increase in your diastolic, your risk of dying from heart disease or stroke pretty much doubles. That's a massive impact from what might seem like a minor change on the cuff. So if you can't feel it, how in the world do doctors find this invisible threat? Well, the process for diagnosing it is actually very deliberate for that exact reason. First off, a doctor is never going to diagnose you based on just one high reading. Your pressure can spike if you're stressed or just rushed into the office. So they need at least 2 high readings on 2 different days. And getting it right is key. You have to be sitting quietly for a few minutes, no talking, and using the right size cuff is absolutely crucial for an accurate number. Okay, so that was the scary part. But now for the most important part. What can you actually do about it? And this is where the really good news is. A diagnosis is not a life sentence. In fact, hypertension is very, very manageable. The way we manage it is with a 2-pronged attack. Think of it like a 1-2 punch. The first part is lifestyle management. This is the foundation, and it's recommended for absolutely everyone with high blood pressure. The second part is medication. These two aren't an either-or. They work best as a team. So let's talk about lifestyle first, because honestly, the power of these changes is just huge. These are the big 5, the cornerstones of getting your pressure down without medication: losing extra weight, seriously cutting back on salt, getting consistent exercise, limiting alcohol, and of course, quitting smoking, which is just a wrecking ball for your entire cardiovascular system. And this isn't just wishful thinking. These changes have a real measurable effect. Look at this. Weight reduction alone can drop your systolic pressure by 5 to 20 points. For some people, that's enough to move them down an entire risk category. And when you combine all these lifestyle changes, you can cut your risk of having a heart attack or stroke by up to 15%. That's incredible. Now, for many people, especially if their numbers are in stage 1 or 2, lifestyle changes go hand in hand with medication. Your doctor has a whole toolkit of different drugs they can use. Some help your body get rid of extra salt and water, which lowers the volume in your hose. Others actually work to relax the walls of your blood vessels to give the blood more room to flow. The goal is always the same: get that pressure down to a safe, stable level. So let's bring it all home. We know this condition is common, we know it's serious, and we know it's silent. But the biggest takeaway here is that it's also detectable and, most importantly, manageable. You can't manage what you don't measure. You can't fix what you don't know is broken. So the real question I want to leave you with is this: do you know your numbers?